Hi, I'm Jamie, a counsellor at the National Addictions Management Service, and today we will be discussing about addictions and detoxification. There are two main forms of addictions. We have substance addictions that refers to the use of alcohol and drugs, as well as behavioural addictions, which are seen in terms of persistent, repeated behaviours that are related to gambling, sex, internet use, shopping, and even video games, to name a few. So, what is detoxification or detox? Detoxification or detox usually refers to the process in which one's system is being cleansed of any substance of abuse, namely drugs and alcohol, with medical interventions to manage withdrawal symptoms. Withdrawal is a combination of physical and psychological symptoms that a person may experience after they stop or they reduce the intake of a substance or certain behaviors that we mentioned earlier. Medications used in detox help one to be comfortable while drugs leave their body and manage the psychological effects that one may experience. Some signs of physical withdrawal may be body pains, tremors, seizures, changes in appetite, nausea, vomiting, diarrhea, fatigue, sleeplessness, sleepiness. It also may be leg cramps and shivering, and even sweating. There are also psychological effects that people may experience, like anxiety, irritability, and even hallucinations. So with substance addictions, it can take days or weeks to get through withdrawal symptoms for chemical addictions. And the length of withdrawal really depends on a number of factors, including the type of substance that a user is addicted to, the duration in which the addiction has even lasted, the severity of the addiction, even the methods of abuse, whether or not someone is snorting, smoking, injecting, or swallowing the substance. There is also the aspect of the amount of substance that a person actually takes at a given time, family history or genetic makeup, medical conditions, and even underlying mental health conditions. So with behavioral addictions, the chemical effects related to the brain's reward systems are similar to that of the psychological addictions of drugs and alcohol. So even though one may not have the physical signs of a withdrawal, the psychological symptoms discussed earlier may well be present. And though the behavior has stopped, these withdrawal symptoms may well still be present, and therefore a detox period may still be recommended as part of a treatment plan. There are two main forms of detox that one may choose from. It could be inpatient detox or outpatient detox. So for inpatient detox, it's a program which is best for people with significant history of substance use involving alcohol, drugs like heroin, and even prescription sedatives, who would also require round-the-clock medical and emotional support. Generally, if one is substance dependent, they would experience very uncomfortable withdrawal symptoms when they discontinue the use of their substance. And typically this would last for a couple of days or even up to a week. Furthermore, one might run the risk of medical complications as a result of withdrawal symptoms. So medically supervised treatment helps those who discontinue the active use of addictive substances, and during this phase, the emphasis is really placed on the medical needs that one may have, and one will be able to be provided the medical assistance to actually relieve the withdrawal symptoms that they may experience. So outpatient detox actually works well for those whose addictions and symptoms do not require intense supervision or round-the-clock medical intervention. And this option is good for those who have a lot of family support and community support in their recovery, and the recovering individual is able to return to their home after each treatment session. Detoxing from drugs can take place in a number of settings, and while it may be tempting to try it at home, it may not be the best option. In fact, in some cases, it can even be dangerous and deadly to even consider even doing so. So many people are under the impression that detoxing from alcohol isn't as dangerous as detoxing from other drugs, but honestly, this cannot be further from the truth. So there are serious potential life-threatening risks involved with detoxing from alcohol, especially when doing so on your own. When you stop drinking alcohol, suddenly your body actually reacts with a series of withdrawal symptoms. And these symptoms can be painful, they can be difficult to manage, and may even last for weeks. So without any medication to help you through it, the process is even harder. So sudden alcohol cessation, or if you stop your alcohol suddenly, what it can cause is hallucinations, seizures, and even heart failure. And this may even result in death. So although this is rare, you never really know how your body is going to react until you go through the process of detox. An at-home detox should only be performed after a doctor or medical professional has actually approved the process. Someone suffering from drug or alcohol addiction should never simply take that decision on their own without medical supervision. Doing so could seriously impact your health, and the repercussions could be fatal in some situations. To begin a safe detox, be sure to consult with a medical professional, preferably one with addiction treatment or withdrawal management experience, and specialists can provide a thorough assessment of your status and your risks. And in determining the appropriate treatment, one may be asked several questions that may be related to the type or types of substances that you use regularly, and whether or not you are currently intoxicated, the frequency and the dose, and even the duration of your use, even pre-existing and co-occurring mental health symptoms that you may be having, your physical and mental health and medical history as well, and previous withdrawal in detox attempts, and how much support you have at home. If during your evaluation, the clinician deems that you are at low risk for severe or complicated withdrawals, they may actually advise you to utilize an outpatient detox program in contrast to more intensive inpatient programs. Outpatient programs can be carried out with regular visits to your doctor's office and outpatient treatment centers. So where can you go? With inpatient detox, general hospitals can actually manage the immediate physical withdrawals that one may experience. There are also specialist centers that actually provide specific addiction help in Singapore. So seek help with medical professionals when in doubt, and do not try to detox on your own. Once detoxification has been completed, one can then begin working through the process of rehabilitation. So in the next series, you'll learn more about rehabilitation.